Okay, hi everyone. My name is Babak Kiarostami. I'm a chiropractor, as Betty said. I have been doing this for 33 years. So I'm not new at it. I've studied health and human physiology and function since I was really 17 when I started UCI. My bachelor's was in biology. I studied every aspect of biology from molecular to micro to evolutionary biology, which at the time I wasn't a believer, so we had to take it. We had no choice. And my study of the way the body works has transitioned into what I developed into as a chiropractor taking care of patients. And not all chiropractors are alike. There are a lot of chiropractors that do purely accident type of stuff. I've known Betty's family, I think, since 1990, and that's the majority of my patients I've known for multiple generations. The biggest message I want to give you today is that when it comes to balance, as I see patients who have aged, a simple step can result in a fall. And that fall ends up causing a fracture or a concussion, or it could be as bad as a hip fracture, which results in emergency surgery. So what I help with my patients, what I try to teach them is how they can minimize the chances of that. You can't eliminate it. As we age, our physiology slows down. That just goes without saying in every aspect. Our reaction time slows down, our healing time slows down, our digestion of food is different, our sleep is not as good. So there are factors that we can control and there are factors that we can't control. Now, I'm very detail-oriented myself. I like I said, microbiology and molecular biology. So I'll share some details with you on what gives us balance. There are different parts of our physiology that give us balance. So the biggest part is the brain, obviously. There's a part of the brain, the hindbrain, that controls balance. It's called the cerebellum. It's just a fancy Latin name that controls balance. Another component of our physiology that's important for balance is our vision. For those of us who are gifted with the gift of vision, when we see, we can tell which way is up, which way is down, and we can tell just by our vision if the next step we're going to take is on a driveway which is kind of sloped to a side. The other part that controls balance is the inner ear. Now, the inner ear is not the part that hears the sounds, it's the part that has fluids in it. On each side, we have 3 rings, and these rings have fluids in them. These fluids swish around, so when we're upright, as I'm standing here, as you're all sitting here, the fluids settle down closest to the neck. When we lie down, the fluids are closest to the side of the head that's leaning. Sometimes those get mixed up or get plugged. And as those get plugged, we can't tell gravity which way is up, which way is down, because these fluids are not slushing around. So common dizziness that people get, or vertigo, which is very common, and people go to the neurologist, they get an MRI, they get all these testings done, and by the time the testing is done, their vertigo is resolved. A lot of that comes from, you can relate to that. What that is from is the difference between what your eyes see and what your ears sense. So your eyes see you upright, your ears sense you lying down. Brain gets confused, the room starts spinning. Now, of course, there's other medical reasons. There are people that have illnesses that cause dizziness. Medication is another common source of people losing their balance and getting injured. The part of your physiology that you can control is training your body to have a higher reaction time. Any tennis players here? Anyone play tennis? Golf? Okay, so if you're playing tennis or golf or any other sport that involves a ball, ping pong, pickleball, that's popular now, you're training your brain to react quickly to a stimulus, the stimulus being the ball traveling at you. So it's not just hand-eye coordination, it's also your eye tracking the ball. Your focus from the ball going from the other side of the court coming to you trains your eye to focus on a moving object. So that helps with balance. That's one thing you can do. Hand-eye coordination is really important. Now, if you were to touch a smooth surface around you, like a table or the side of the TV, you would feel, your fingers would sense that texture. Your fingers could sense the difference between temperature between that sofa and your phone or the cup of water. Well, all of our feet have that same capability. Our toes, the soles of the feet, are extremely sensitive, and they can sense the environment. They send messages to the brain as to what temperature, what texture, is there vibration, is the source of pain. If you step on something sharp, you would feel it if you were barefoot. All of us wear shoes.
Interesting.
So we have disabled the soles of our feet from sensing. They don't sense. They're always sensing the bottom of our shoes. If you step on a nail, you don't jump back. If you step on a rock that's steady, you may sense it, but you won't sense it until the very last moment where the rock wobbles. So that's one thing you can affect, is to stimulate the soles of the feet. But how do you do that? You have to walk barefoot. If you're not capable of walking barefoot, you can sit in your backyard and put your bare feet on the ground. You can develop that sensory component of balance. Your brain gets information from your foot all the way up, and in a microsecond, in a fraction of a second, your brain assesses what to do with that information. If you were to go for a 10-minute walk, 10 minutes is about 160 steps. 1 minute is 160 steps. 10 minutes is 1,600 steps. So that's 1,600 times in a 10-minute walk that your foot sends information to your brain. And your brain assesses that information and readjusts your balance. Now, again, like I said, with shoes that we have to wear, we have disabled that capability. We don't sense as much. The other part we cannot control, like I started with, is aging. Our nerve systems slow down, just like everything else slows down. So there are things you can do to stimulate that, to optimize that. So as the example I gave you, you step on something and a flash, and not even 1,000th of a second, your brain assesses what's on the ground. The source of information goes from the sole of your foot up your leg, through the spinal column, to the brain. And the brain assesses that info and sends information back all the way through the spinal cord, through your leg, back to the foot, and tells the different toes what to do. That conduit, that pathway, is your nerve system in your spinal cord. If your spinal cord is not functioning at its optimum, then you're going to slow down even further. So, like I said, I'll reiterate. We naturally slow down. Now you have the added component of pinched nerves in your neck, in your back, in your hip, and any of those are a combination thereof. Now you're even slower. Your reaction time is slower. So whereas 5 years ago, 10 years ago, you could easily step over that bumper guard, now you can't. Your brain sees it, but the travel time is not 1,000th of a second, it may be slower. So by the time your brain wants to send info to say, bring up your foot up another inch, it's too late. You've tripped and you've fallen. And I hear this every week. I can't say every day. Just yesterday I heard of someone's mother-in-law who fell and broke her arm. My own mother parked in the parking lot of LA Fitness. She went back to check something on her car and she didn't see the bumper guard. She just tripped over it and fell. It's a very common thing. Now, a broken arm is much easier than a broken hip. Even if it needs surgery, you're not disabled. If it needs surgery, you're disabled. So here's another factor that we don't pay attention to as we do our daily routines. Most of us are looking down most of the time. You're cooking, you're cutting, you're writing, you're reading, you're looking down. So our posture is like this, starting in kindergarten, going all the way until we're done on this side of heaven. You're constantly looking down. That also squishes down your spinal cord. That also squishes down your balance. When I started to talk about the inner ear, if your head is used to looking down, the fluids in your inner ear are more towards your jaw, not straight up. So what's the solution on that? You learn how to look up. Again, if you're into sports, or if you're watching the clouds or the birds or the treetops, you can train your body to have more of a balance of sometimes looking up. And that creates a balance as well. Because we fall so often, we get into the habit of looking right in front of our feet because we don't want to miss a hole. We don't want to miss a step. So that contributes to the balance issue. Now, there are exercises you can do that will help you with balance. So our body gets used to the environment we put it in. If someone goes to the gym, the muscles get bigger. If someone looks down, their posture starts to look down. So how can you move or help your balance improve? You can help your balance. I often teach some people who are having balance issues. Incidentally, people who walk barefoot from time to time tend to have better balances because of everything I said. It's not good for your feet. It's not good for the soles of the feet.
Again, I didn't hear that. People that
walk barefoot from time to time, they're training that body to brain communication. Their soles of the feet can feel, can sense temperature, pain, texture. All of that is sensed through the soles of the feet. So they tend to lose their balance a little bit less. As far as an exercise you can do, and this is really, you got to be really careful. Except for Betty, you guys are not my patients, so I don't want to cause an injury. You got to train yourself on how to stand on one foot by minimizing the chances of falling. I'm not saying eliminating, I'm saying minimize. It is hard. So for that, I would suggest you stand somewhere safe behind a chair. And I'm going to use this chair that I just folded, preferably a higher chair for most of you. And this has to be done barefoot. This cannot be done with shoes on, but I'm not going to take my shoes off. So you stand with your hands on the chair, and then you try and lift one foot just an inch off the floor and try to balance yourself. The chair is there to grab you, so if this chair was higher, I would grab it like this. And just stand with one foot and see if you can hold on to the chair and hold your balance. If you feel safe, take one hand off. If that's safe, then I would put the hand back on with the foot still off, suspended in air, and start turning your neck around. So that teaches you, because when we walk, we're not standing rigid like a robot. We're moving our head, we're talking to someone, we're looking at the plants. So that's a natural mimicking of the normal motion. So you're holding on to a chair, one foot is suspended, holding on to something, one foot is suspended, and you start turning your neck around and see if you can balance on one foot, and do the same with the opposite side. Now, if you were to start doing this, you're going to find one side is 5 times stronger than the other side. Because just like we're all right-handed or left-handed, we're either right-footed or left-footed. So don't get discouraged. Why can't I do this with this other side? One side is always going to lag. And the side that always lags is the side that trips you the most.
And how long?
Well, if you can build up to 15 seconds, that's a huge goal. So I don't want, like I said, if you decide to do this, make sure you're not standing next to a sharp object. Make sure you're not next to a fireplace mantle. You want safety. Safety is most important. I don't want you to develop or help develop balance and then break a bone. That's gonna defeat the whole purpose. So you gotta be careful on baby steps. So I would start with 2 seconds, 3 seconds. Some people, as soon as they take one foot off, they're wobbly. So just the fact that they can lift it up for a breath is enough. They don't need to do it for 15 seconds. So like I said, you're not my patients. I haven't assessed you to a lot of people. I don't encourage this unless I can supervise them for a good month or 2. And then I tell them, okay, now you can go ahead and do this at home. So it's, I put a timer so to be respectful of your time. I have 4 more minutes before the questions. As far as what I do, I identify sources of interference between your brain-body communication. That's how the body functions. Right now, this room is warm. My body, my skin is sensing, everything in me sensing a decrease in temperature, sending information to my brain. My brain is then taking that same info that I'm telling you about feet and sensory perception. It's also controlling the skin. My skin is starting to get moist. That's a natural cooling mechanism. My heart rate may be increasing or decreasing depending on the temperature and the humidity, depending on what I've done today, depending on the barometric pressure. None of us think about these things. So the body tells the brain what's in the environment. The other mechanism, which we're all taught since elementary school, is taste. We can see, hearing. Those are all sensories, the primary sensories, but we don't talk about touch. That's not very much emphasized as we grow up. And then, as I mentioned earlier, the brain tells the body what to do. So if there's pinching in your neck, of the nerves in the neck, if there's pinching of the nerves in the back, if there's pinching of the nerves along the way, you're going to have a slow reaction, even if you do the exercises. So in a nutshell, the things you can do are the exercises I mentioned, which is very simple, but if you do it consistently, your brain will get trained. And then when you go to take a step, whereas you would normally fall, you're much less likely to fall. The other thing I suggested to you was to try and look up. Look at the birds. Don't always look down.
Get rid of the phone.
Well, that is, I don't know what the solution to that. I don't see anyone not looking at their phone, whether they're standing or walking or driving. Everyone is looking at their phones, and that's part of us. These funny watches that most of you don't have, these are creating another problem because we're all looking at our watch like this, and that creates a different problem. Shoulder issues, which affects the neck, which affects posture, which affects balance. And it goes without saying, your chemical makeup, what you put inside your body is really important. Hydration is really, really important. I've had a couple situations when someone is ready to pass out at the office, older persons usually, and it's the number one thing is dehydration, lack of water. If you're not physically active, you're not thirsty, so you don't drink water. A lot of people don't like to wake up to go to the bathroom. They don't drink water. So dehydration, your blood is 2/3 water. If you're lacking water, then you're lacking blood plasma or fluid. That can contribute to dizziness or lightheadedness or tripping and lack of balance. So there are factors you can control and factors that you can't control. And in a nutshell, I hope I could shed some light on this. At least you can begin to look at what are the possibilities, and don't wait until you get injured. A lot of people wait until they get injured and then they want to work on their balance. The longer you wait, the harder it's going to be. You can train a 65-year-old nerve system much easier than a 70, which is easier than 75, which is easier than 80. So, and I don't suggest you do these exercises for 20 minutes. It's just a matter of doing it for 3 minutes, for 1 minute, but doing it 5 days a week. Take 6 days, 6th and 7th day off. If you take that into account, you can even do it while you're brushing your teeth if you're stable enough. Just put your hand on the counter and just brush with one foot up. Because then you can do two things in one.
That's a timer too.
And it's a timer. Okay, I'll take questions. If any. You all got it. Perfect.
Where is your
Yes.
office?
I am in Costa Mesa.
Oh.
Yeah. Yes, ma'am.
Is there any particular shoe that is better to wear when you have to wear shoes and are not barefooted for balance?
Well, the shoes that are fancier are typically not so good. So the old Birkenstock style shoes that no one wants to wear anymore are probably the best because it allows all 5 toes to actually feel the ground. Because we wear shoes depending on your posture, depending on your hip orientation, a lot of people put most of their weight on the outside of the feet, on the little toe side. Some people put it on the big toe side. All 5 toes are there for a purpose. They were created for a reason. They all have massive sensories. So the old school comfortable shoes are the best. And preferably not flip-flops where you have to, force your toes to keep the flip-flops on. That's why I suggest things like Birkenstock, not necessarily just that brand, but things that keep your feet secure, or tie up, lace up. A lot of people don't want to bend forward to tie their shoes, so they wear shoes that are not tight on their feet.
So wearing a tight-fitting shoe if you're walking or walking your dog, which pulls on you and stuff, is
Better.
okay.
If you can tie your shoelaces without getting dizzy and falling.
Thank you.
And there's always Velcro.
There's always Velcro, yes. As I mentioned that leaning over and falling, I think of this patient who was picking up a newspaper from her driveway. She lost her balance, fell, broke her neck. And well, yeah, and she had lightheadedness. She had a history of, breathing issues. So it was a combination of stuff. And the body never heals perfectly from that. She didn't get paralyzed, but she never fully recovered from that. Her health went downhill from it. That's why I mentioned it's funny, but it does happen. People lean over to tie their shoe and they fall.
Yeah, sit in a chair, sit on the bed.
Yeah. And bed is another interesting thing. This just came up with someone yesterday. If your bed is too high, that's another cause of injury. If you have to climb into your bed, if you have to climb out of your bed, even with a step stool, you're groggy when you first wake up. You're more likely to lose your balance at that point. And your blood pressure. There's this fancy term called orthostatic hypotension. That means if you're lying down and the moment you sit up, your blood pressure has to adjust, has to adapt. Like I said, in an instant, your body tells your brain that it's now sitting up. The brain has to decide to have the heart pump harder to get the blood up to the brain, because when you're lying down, it's not fighting gravity. It's all on level surface. Right. When you sit up, blood pressure has to go up to get blood up to here. So you're more likely to lose your balance first thing in the morning, going to the bathroom in the middle of the night. So those are things to be, aware of. And there is no perfection. You just try to minimize chances of loss of balance. Yes?
So walking, there are certain things that people say, like you should raise your legs, to do this kind of stuff walking. What are your suggestions about the best way to just walk?
Well, people who say to raise your leg to walk, that's a different purpose.
Oh.
If you're an athlete and you're trying to run faster, or you want to start a speed walking contest, by all means, do that.
Oh.
But my goal here is to try and minimize chances of losing the balance.
Okay.
So walking should be natural, but I'm glad you asked that question, because a big part of walking that's lacking, part of it partly because of phone usage, partly because of walking the dog, is swinging of the arms. People aren't swinging their arms. Even if they don't have a phone in hand or a dog leash, their arms are not swinging. Just from the fact that we're all used to sitting behind the wheel, behind the desk, cooking at the kitchen, sewing, everything that we're doing is with our arms in front of us. So the best way to walk is to watch a 2-year-old and watch them how they walk. Their arms are swinging, their legs are swinging, they're not marching by pulling their legs up, and they like to be barefoot. So.
Wonderful.
Yeah.
I love free medical advice.
I have some difficulty going up and down stairs. I seem to go a lot slower than Betty, for example. She's going up and going down, and I'm like, carefully taking my steps.
Well, you're obviously using care for a reason, but having known Betty for a long time, she's always been fast.
Yeah,
if she's going to her car, she's not strolling, she's walking fast. And you can't compare yourself to her. So what's good for you, you don't need to be as fast as her. Just send her ahead to make the reservations. Because that's dangerous. If you try to catch up to her, you're more likely to fall.
Yeah.
You can't go from your speed to her speed in a matter of a year or 2 years. It doesn't work. It's like an example came to mind. It's like going to the Performing Arts Center and seeing the dancer do what they do. That's not 5 days of training. That's a lifetime of training before they get to that level. And walking and balance is the same thing. It's a process. So if you start today in 2022, by 2024, if you do the exercises and you maintain what you had in 2022, you've done well. So the goal isn't to really get faster. The goal is to at least maintain what you have now. Because if you don't do anything, you're going to go downhill much quicker. Not you, me too. Yes.
If you're getting some numbness in the bottom of your feet, or is that what they call neuropathy, is that coming from circulation, not getting down to the bottom of the feet? Or
So neuropathy is a fad term of this past 10 years. It's being used to market certain practices. It is a thing, and it's seldom circulation. It can be if someone has a blood clot. It can be a circulation problem. If someone has varicose veins, it can be. But neuropathy, when it does exist, is something coming from the spinal cord or from the side of the leg. Now, unless you're a bicycle or motorcycle rider, it's not likely to be from the side of the leg. It's more likely to be from your spine. But having said that, if the sole of your foot cannot feel the ground properly, you're more likely to lose your balance. Because that sensory pathway is blocked, most likely in your lower back. So your body can't tell the brain what's going on. And it can happen to the hands too, but hands are not involved in balance. A friend of mine's sister had to have surgery in her neck, in Germany actually. He was just telling me this the other day, this week. They severed some of the nerves in her neck, and now her hand doesn't feel anything. So he said she can put a knife on her forearm and not feel anything. And some of these nerves have affected the face, so she can chew the inside of her mouth and not feel anything. So nerves are really important, and this poor gal has to eat with a mirror, so visibly watch herself eat to minimize chewing. So nerves are really important. That's why I love my profession, because I'm not a surgical practitioner, but I optimize nerve function, so that things like yours can be handled non-surgically, if possible. Sometimes surgery is the only option. Yes?
I have, this is weird, okay?
I can't wait to hear it.
If I have too much weight on one cheek, then my hand goes to sleep, my opposite hand.
That's not weird.
Thank you.
Yeah, it's not weird. So
If I center myself, it comes back.
So that's your body self-correcting. That's your body telling you not to sit that way. Because if you sit this way, this hand is going to go numb. So you go to a neurologist, they're going to give you an anti-inflammatory to deal with that. But I'm going to tell you, listen to your body and correct your sitting, and then the numbness goes away. So that's not weird. That's the perfect example, body to brain communication.
Yeah, because if I center myself, it does go away.
Yeah. And I have patients who say, I feel numbness, tingling, or neck pain, or back pain, and then I wake up and I move and it goes away. I said, that's your brain telling you wake up and move. If you stay in bed, you're going to cause damage.
Right.
But we all are so focused on a good night's sleep that we say, but I can't sleep. So a lot of people want to take pain medication or anti-inflammatories so they can sleep through the night instead of having 3 days, 5 days, a month of discomfort
Right.
to let the body heal. Now, I'm also sensitive to people that have chronic pain, and it's getting old, and it's getting to them spiritually, emotionally, and at that point, there is a room for pain meds and anti-inflammatories. But I always suggest doing the natural stuff first. If it doesn't satisfy, then you go to the more dramatic efforts. Yes?
You're talking about when we walk, we should be looking up. I think at least for me, one of the reasons I look down is because I think I'm gonna,
Trip.
yes,
Yeah,
I'm gonna fall. So,
Yeah, I understand that, and I mentioned it during the talk, and I'm cognizant of that. So yes, you have to be aware of it. So, but if you don't try and look, maybe not right at your feet, but 10 feet, 20 feet ahead, your posture is naturally going to go like this, and very soon you're going to look down only. And if that's your only option, if your vision is such that you don't trust 10 feet in front of you, you have to look in front of you. By all means, abide by that, because I'd rather you not fall.
Yeah.
But when you're sitting, you can practice looking up.
okay,
You can practice looking around.
Yeah.
And certainly if you have a balance issue to begin with, that needs to be addressed before you do any of these things. And the first step, most people are on medications, is check the side effects of your medications.
Yeah.
Because that is a big source of injuries these days. Yes?
One thing we've noticed, because we've had family members who have fallen downstairs, is using a rail. So often I see people just run down the stairs without, and I mean, if you're younger, that's, I guess, fine, but older people, I think, should be encouraged to use
The rail.
rails if they're offered.
They're mandatory. You can't build more than, I think, 2 steps without putting rails for a reason. And even younger people fall running down the stairs and they break bones. I see them. They miss a step. They're wearing socks going down carpeted steps. So yes, rails should be used.
Some places though don't have them, or they have we were just in a hotel this weekend and had a big wide thing that you were supposed to, I guess, hold on going downstairs. There wasn't a skinny one you could really get your hand on, so I don't, well, that was in Arizona, so maybe California has a different.
Well, from what I've seen, maybe they were made, maybe it's an older hotel, I don't know.
It
But
is.
for safety
That's right.
reasons, they have to have,
A rail for this.
they have to have accessibility.
That's great.
And places like that, I'm sure, would tell you to use the elevator if you're in doubt.
Right.
Because they don't want to be sued.
No.
Anything else?
Very good.
That's
Awesome.
great.
That was wonderful.
Thank
Thank you. Thank you for having me. Thank you.